My name is Deb Barton, and I am a clinical nurse researcher at Mayo Clinic and in both the Department of Nursing and the Cancer Center. Clinically, I've been a nurse for 27 years now, and I've worked in various settings, both as an inpatient nurse, in ambulatory care, in home care, and even hospice. I have my bachelor's in social work, and then went into nursing through an international experience that I had in Brazil. Got my master's in nursing then and went on for my Ph.D. All of my clinical experience in nursing has been in the area of oncology, caring for patients with cancer and their families. And both my background in social work as well as nursing was really instrumental, I think, in my choosing oncology as an area of practice. And it's been something that I've been passionate about my entire career, continue to be passionate about. So all of my research then has been in oncology. Not surprisingly, when someone is diagnosed with cancer, it is definitely more than just that person being diagnosed with cancer. Their entire extended family goes through the experience, and so being able to care for those needs and help improve that experience has been very meaningful to me as a nurse. So specifically, my program of research deals with both acute and chronic symptoms and side effects of people having been diagnosed with cancer. So that all of my work has been patient-centered outcomes, so it's how patients and families report that experience, not toxicity scales or something that a physician would rate in terms of what a patient experiences, but has really been from the patient and family's perspective. And I've done a very broad amount of work in symptoms, from hot flashes to cognition to nausea and vomiting to sleep to fatigue, sexual health, peripheral neuropathy. But more recently, I've been focusing on two areas, and that is fatigue and sexual health, and really working on bringing pharmacologic interventions in combination with non-pharmacologic interventions. And I started that in hot flashes, where we found that antidepressants helped relieve hot flashes. So using a little bit of antidepressant so that it doesn't cause extra side effects for women, and adding some behavioral interventions such as hypnosis has been a really nice complementary way to reduce hot flashes without trading side effects, and has been very effective. And so now I'm doing that sort of strategy in both fatigue and sexual health. So the research that we do in managing symptoms for people with cancer has had a lot of direct practice. In fact, the group of researchers that I've worked with for hot flashes, we've really defined what the standard care for reducing hot flashes has been, namely antidepressants, low-dose antidepressants to relieve hot flashes. So early on in this work, when we were doing that research, I would meet women and men who also get hot flashes when they get treated for prostate cancer, who've been in situations where they haven't slept for months. They are no longer sleeping with their significant others because they're up all night with sweating and having to change their bedclothes, which is very disturbing to their partners. So they've had to be in separate rooms, and have been very fatigued because of their lack of sleep. And when they've been taking part in our studies, or from the results of our studies and knowing what helps people, they've gone to finally getting sleep after months of no sleep, being able to move back into the bedroom with their significant others, and really overall just a total improvement in their health-related quality of life. It's been very gratifying to be able to contribute to that. And then most recently, I had a situation where I have a study going on right now looking at a vaginal gel for vaginal atrophy in women who've been treated for cancer and have very low levels of estrogen. So it really affects their vagina. And a woman who is quite young, on the young side, who was told by her healthcare provider that she should really start thinking about other ways of intimacy with her husband because her vagina was just so fragile from the lack of estrogen that she just couldn't tolerate having sexual relations with her partner. She went on our study. 12 weeks later was enjoying sex and without pain, and it turns out that she was on the product that we were studying, and it really improved her relationship life with her husband. So that was very gratifying. We don't, at this point, know the results of that entire study. It's being, the final analysis is happening this summer, but that was just one anecdotal, if you will, experience of a patient on the study. And I'm hoping that our results support that person's experience and that we have found something that can help women with that problem, because it's a big problem. So I think it's those kinds of patient stories that keep me motivated to continue to do the research. And in fact, as a researcher, it is really important, and many of us in the Division of Nursing Research talk about this. It's very important for us to stay clinically connected, because we then continue to see what the patient needs are, and we can continue to get motivated by being able to address those needs, quite frankly. I will also say that my work in the area of cancer has been such that since I've worked in this area my entire nursing career, one of the things that people always say to me when I tell them what I do is, "Oh, how do you work with people with cancer? That must be so depressing, that must be so difficult." And actually, this might sound a little strange, but it's really quite the opposite. I may not be able to change whether somebody gets diagnosed with cancer, but I can certainly change what their experience is after that diagnosis. And if I can be there to support them and to find answers for some of the things that they struggle with after their treatment and diagnosis, then that is actually quite a positive thing as opposed to a depressing thing. And since they have to go through it anyway, I am very happy to stand by them and their family and try to make that a better experience. So it's far from depressing. It does get sad sometimes, but we are fortunate in the sense that there's a fair amount of resources going into cancer-related research, both in the treatment to make cancer go away, as well as the improving the long-term after effects of being treated. And so there is a lot of progress being made that helps people.